I am the OIE focal point as far as providing information to the OIE on the United States and that, and which includes, you know, our endemic type diseases. I get involved in the risk analysis and risk assessment just on the peripheral of it. I'm glad I got a lot of support in here with Amy and Lisa and Beth who can answer any questions that may come up here. We're going to go at this from a little different agenda than as far as the precautionary principle than you heard this morning and earlier, as far as what should happen if we're importing and we want to put increased precautions in place. So we're going to be looking at that way. We're going to be looking at what should be the scientific, what should happen. We're not going to be talking about really the emotions or the politics that can happen after all this. Then we're going to review the risk analysis process. For the purists and the risk assessors or risk analysis group, you know, risk assessment is part of a risk analysis. And then we're just going to barely touch on the quantitative versus qualitative risk assessment methodology. Where did this come out of? The World Trade Organization in the 90s here, as far as their SPS or their sanitary and phytosanitary agreements. It sets out member countries who were trying to increase trade, but they also recognize that countries have the right to protect their home products in their country from animal diseases and plant health. You know, they have that right as a sovereign country. With that, though, there's some obligations that countries that are partners in the WTO take on. About 159 of the 196 countries in the world, 80+% are members of the WTO. The OIE, or the World Organization for Animal Health, which is the SPS authority for animal health, animal diseases. There's about 178 members, so it's a lot of members in the OIE. What's the relevance of this to the risk assessment and risk analysis here? Again, it's stated very clearly as far as in the Article 5 there, is that member countries can ensure that their sanitary or phytosanitary measures are based on an assessment. So they have the obligation that they base what they put in place on an assessment, and it's appropriate to the circumstances. And as far as protecting of human and plant health. And the bottom line here is what we're talking about, risk assessment techniques developed by relevant international organizations are utilized in that risk assessment. If you are familiar with the OIE code, the chapter 2 of the code, the risk analysis there, Tom and Dr. Kasari, Dr. Scott, a lot of the people from the risk analysis actually had a lot of input into that code, into the writing of it. Again, in about 1998, the WTO recognized the OIE as the SPS standard setting organization for the WTO related to animal health, animal trade there. Again, same thing, you know, that section on there, we'll go through some of these pretty quickly, some of it's repetitive. Besides the assessment of risk, there's other things that go into key concepts into these SPS agreements. Some of it, such as harmonization, the equivalence, regionalization, compartmentalization, we'll go into a little more detail on there. Transparency, countries want to know how you came about with that information, what surveillance are you using, what data are you using. And the notification, that's where I get involved. You know, countries reporting of diseases and what's occurring in their country. So governments are encouraged to harmonize all this information. Their animal health standards with international standards, guidelines and recommendations. Again, the OIE is a very important part of this. Harmonization means the establishment, recognition, and application of these sanitary, phytosanitary measures. Again, doesn't mean they can't go outside those, but part of the harmonization is that they're using everybody's on the same pew, everybody's in the same book. It's not deviation. I mean, they can deviate. Countries can deviate from it. But the requirements are stricter then. You can't have the requirements stricter in your national country than you're going to set for somebody else. I'm sorry, I said that wrong. You can't have restrictions stricter for a country that's importing or exporting to us than those that we actually have in our country for our endemic. And they have to be justified on the basis of this analysis of the scientific evidence and the risks involved. Equivalence, many of you have heard that term. Equivalence doesn't necessarily mean the same. It means when you're looking at it, and this is what our risk analysis, our risk assessment folks will look at, is the other countries' infrastructure as far as their veterinary infrastructure, their movement controls, their surveillance policies. Is it in law that this has to be done? What type of surveillance do they have? Do they have the laboratory system that can actually identify the disease? Do they have the capacity to handle it? Is there border security that they don't get it from another country coming across? Do they have actually internal movement controls that they can put in? So it's equivalence. You know, they're looking at, does that country able to provide us assurance that they safely can export to us? Some of the new concepts, not new concepts, but concepts you're going to hear more of. There's a lot of work going on between us and Canada and other on regionalization and zoning for us to start recognizing this more. You're going to see it as far as in the United States more, as far as this term and hearing more about compartments. And again, nothing magical. You know, it's a region or zone. It's a geographic area. But again, it has to be able to control. It contains that subpopulation of animals in that region. And we're saying that they either don't have a certain disease or number of diseases that's not there. But again, it requires surveillance to make sure. It requires control and biosecurity methods to actually make sure that those things are happening. Compartmentalization. Again, another term you're going to be hearing a lot about. Compartmentalization can get confusing sometimes. Some people equate it to a different species or whatever. Wildlife is a compartment. Actually, you know, the OIE defines it as, you know, it can be more than one establishment, but the big things under that, with that animal population, and they're usually related to one disease or multiple disease when they talk about this compartment. Again, it requires surveillance. The big thing is biosecurity measures and management of these. They have to be very similar to, and it has to be recognized by the country that this is a compartment. Again, recognition of the animal populations of the different health status. We can use the zoning and regionalization. Again, that's a geographical basis, or the compartmentalization. Again, where management and biosecurity are very important. Again, they're both very, very similar. There's different responsibilities. Usually when it's a disease-free zone, there's going to be some government or official action, regulatory action, recognizing that. Whereas compartments are going to often be a private sector trying to trade and have that specific compartment recognized. They're going to be putting in for it. You need close supervision by the federal authority to actually possibly what they call accreditation of that facility or that procedures that they're using in the compartment, that they're actually meeting those goals of the what they say they are. And just again, just a little bit more details on it. I remember Tom was a professor, and there's quite a few details as far as to drive the points home, but which is good. We can show here a regionalization from this country here. All this can have interstate trade. We get some infected in there, or we have an outbreak, we can't have trade from that area there. So it's on a geographical basis. What can we do? You're seeing more countries apply for this regionalization and zoning, or they'll actually say we don't have it in this part of the country. Again, they have to prove that there's methods to keep it, that they know that it's there, the surveillance, and that has to be available to make sure. Once it's there, they can have interstate trade or international trade from that area they're applying for. Example, many of you familiar with the exotic Newcastle disease quarantine, where we had the 5 states in the United States listed as zoning. Again, these 5 states were recognized in the regulations that they were, zoned differently, and they were also interstate movement wasn't allowed outside of those areas on certain parts of it. Just a little bit more on compartmentalization. You can see if we have something like this, again, it's under more that we have the disease. If we're looking at a certain disease in there, it's interspersed. We wouldn't like interstate trade or international trade on that. But if they do certain ones, put together a management and biosecurity system, we could actually not trade with those that have the disease, but with those that have put these in place, we can actually go ahead and have the interstate trade. Again, as I said, there's obligation when we go outside of the SPS or type of agreements. It's also, if we're looking at regionalization, compartmentalization, it's very important. The epidemiology is so key in this as far as who, what, how, where, when, how this all happens, that it has to satisfy us as far as there's a scientific basis for them to be doing this. Again, on the harmonization, equivalence, transparency, and notification, they're the basis for mutual trust of a country as far as the veterinary services between the veterinary partners. So all that is part of it. Again, how does the precautionary principle work and fit into here? It's actually, again, recognized that countries can put more stringent control policies in place if they suspect that there's going to be harm, there's information unknown, the policy might be harmful as far as bringing it in. Again, the burden of proof lies on that person, that country that is putting those stricter burdens in there. Again, the precautionary principle, as far as the WTO, recognizes that the risk analysis, risk assessment is a very important part of it, and justifying, especially for certain diseases, trying to put all the regulations that the country can do that and utilize it. Again, they can't do it arbitrarily, or they can't do it with discriminatory between one country or another country. They have to use it consistently. And that's basically what that says. They can use the if in doubt, keep it out. The zero risk approach, can't be used without having justification on it. Again, just more on that it has to be based on a good risk assessment, risk analysis. And again, it's consistent with the World WTO articles and OIE risk assessment. This is just another call from one of our colleagues, Cristobal Zepeda, as far as showing when this can be put in place or the SPS agreements are actually used. You can see if the disease is exotic to a country, they can go ahead and put in precautions. If is the disease under official control? No. You can see we can go out here where we can actually, that there's actually invalid use of them. So if we go down here and we can show that there is not equivalency, there's SPS standards in place, we can actually, those precautions are legitimate to put in place. Just a little bit on risk analysis, risk assessment here. What is risk? Risk analysis. We'll hit on the risk assessment. which is part of the risk analysis. Risk, this is the OIE definition from a couple of years ago, the likelihood of occurrence and the likelihood magnitude of consequences. It can be biological, it can be economic, of an adverse event or effect to animal or human health. There's other definitions of it too. What's the elements of a risk? Many of you are aware of these. It's the probability of it happening. That adverse event, the consequences or the impact from it, the uncertainty of it happening, and are we able to manage it? Another way of saying that, what can go wrong? How likely is the event to occur? If the event happens, again, what are we able to do about it and to mitigate it? The risk analysis is basically an organized way to answer these questions and incorporate, information as far as communication, which you'll hear more of on some of the other presentations. What's in a risk analysis? Again, there's 4 parts of it. What can go wrong? How likely is that event to occur? The actual risk assessment, which is part of a risk analysis. The risk management, again, what can be done to mitigate it? And the communication, who do we communicate? How is that communication going? A risk analysis does not establish the acceptable risk level by itself. It doesn't describe the certainty that the event's going to happen or introduce or the consequences. It's not there to determine policy. It provides input to the decision. As many of you are aware, there's a lot of decisions that politics and emotion, etc., go into it. Hopefully risk analysis actually, with good scientific policy, good scientific data, can override some of that. What's the risk assessment, which is part of a risk analysis? Basically, we have the 4 parts, and we'll hit them again. The entry, the establishment of it, the spread of the disease, and the consequences. First of all, we have the entry. What's the chances of it coming along? The biological pathways, very important part of it. We need to look, how does it actually get here into a particular environment. Important part of it is pathway analysis. We can estimate the probability of that occurring if we have enough data. We can either do it qualitatively, or hopefully if we have enough data, we can do it quantitatively as far as actually a numerical estimate of that happening. Pathway analysis, again, another definition of it is just the systematic assessment of the pathway along with foreign animal disease agent that might enter the U.S. and establish an outbreak of disease in animals or man. And it also could be applicable as far as finding the pathway, how domestic disease can spread from one part of the country to another part. Very important as far as its uses. It's risk assessment can be used there. It's key to having that in there. Targeted surveillance. How do you know where to put your surveillance unless you know where those pathways are? Again, many of the emergency preparedness and response people utilize those pathways because that's where they actually can respond to those diseases. And just a general on the steps here. Again, much of it's on the epidemiology of it. Understanding that host, that agent, the environmental interactions, the disease triad, where does that come from? As far as looking at that information, they'll develop a list of potential pathways. Many of them will be described out and drawn out. This is one that actually Dr. Kasari worked on as far as Rift Valley fever. You can see the different pathways there, when it happens, when we actually get down to here, the disease outbreak happening. This was one I think they published. I don't know if this is the actual one. Then they evaluate the feasibility of the pathways. Step 4, they identify the populations of risk and how likely they are to enter the country, and that those animals or populations at risk being exposed. This is something we're always dealing with, the gaps in our knowledge of what's going on in those pathways. Reduces the certainty of the confidence to place it on the feasibility of these actually happening. We have to consider that there is always gaps in that knowledge. Part of the risk assessment is the exposure assessment. Again, we're looking at how that actually goes into the country and how likely it's going to happen that it's going to take root in the country, in the population there. We want to, as I said before, we would like to do it very quantitatively if we have enough data. A lot of times it's very qualitative. The consequences, again, part of the assessment. It describes, as you're aware, there's direct consequences of the disease happening, the costs evaluated, the lab costs, the treatment of the animal diseases. And there's also a lot of indirect consequences that a lot of people don't think of. Like the example is the FMD in England, the effect on the tourist trade, how it was a great part of the indirect consequences of that happening. Then coming through the risk estimation, it's taking all these things, taking that risk assessment, that exposure assessment, that consequence assessment, and developing that risk. Again, we're just going to be barely touching on it. We can come up with a quantitative versus qualitative risk assessment. Too many people around the world and in our country anymore think that there's such thing as zero risk. There's no such thing as zero risk. It doesn't occur. There's risk in everything you do. Quantitative risk. This is where we try to get a numerical value. It's very objective in nature. That's what the purpose of it is, and what the good part of the strength of it is. And it can indicate the probability of something happening to a certain degree. It's more profound, the probability of occurrence of an adverse event. It's informed decision making. They can actually use it a little bit better in the decision making. Again, there's disadvantage though. It's going to require more time. It's going to require more import resources. It's going to require more data. And it sure is not possible in all circumstances. We'll actually look at a scenario tree for each part of it and come up with the relative risk of something occurring. There's uncertainty. There's no exact value for any of these parameters. It's necessary to produce an estimate that incorporates that uncertainty and variability. And this is where a lot of times you'll see the use of the simulation models running multiple equations of the risk happening, coming up with the different uncertainty. Again, it's not a point estimate. It's going to be a range of values of the probabilities. It's going to reflect that variability and uncertainty. Qualitative, again, it's more to describe what's occurring. It's more subjective. Some terms you'll often hear on these are high, medium, low, or negligible. Can't talk with the cold either. Again, subjective in nature often. Not to say that it's not important data and doesn't give you information, good information. It's faster, it's broader utilization, the scope of circumstances. It doesn't provide that numerical, it's less precise. Again, just to wrap this up then, The risk analysis process, there's 4 steps to it. Again, that's the hazard communication, risk assessment, risk management, risk communication.